Welcome to the Farming Your Career podcast with host Dr. Aaron L. Albert, where we explore a variety of healthcare and pharmacy-related topics, including career development, healthcare IT, informatics, innovation, entrepreneurship, STEM, women's issues, and more. Farming Your Career podcast is part of the Pharmacy Podcast Network, and Aaron has had the #1 most downloaded episodes of 2016 and 2017 of the entire Pharmacy Podcast Network. Now, here's your host, Dr. Aaron L. Albert.
Welcome to Farming Your Career. I'm Aaron Albert, and today we have a very special guest and a very special conversation. In fact, we're breaking it into 2 episodes. We have a conversation today beginning with DeAnn Mullins, who has worn many different hats in pharmacy practice. She joins us today looking back on the year of her presidency at NCPA. She's also an entrepreneur and owner of her own pharmacy at Mullins Pharmacy. She's also a mom and a woman who is a leader in pharmacy practice. And last but not least, she's been interviewed as a drug dealer. So give a listen to this first part of a 2-part episode series that we have with DeAnn Mullins.
This is DeAnn Mullins, and I'm the immediate past president of NCPA, and I own Mullins Pharmacy in Lynn Haven, Florida. And you are listening to the Pharmacy Podcast.
All right, so we're here this evening with DeAnn Mullins. DeAnn, welcome to the Pharmacy Podcast.
Thank you so much, Aaron, for having me on your podcast. It's super exciting, and I'm really happy to be here.
And I think we need to thank somebody for connecting us, and that person is Eden Salter over at Cardinal Health, because you and I met for the first time last summer at the RBC with Cardinal Health, and we were on a women's panel together.
We sure were. And she's an amazing lady and has done a lot for women in pharmacy. She's had great vision and she's worked really hard and brought a lot of strong women pharmacists together. And it's been great.
Yes. So we're going to talk about you tonight and your role as immediate past president with NCPA. So let's start with the question that I always start with all of my guests. How did you get to where you are today in terms of your career?
Okay, gosh. For as long as I can remember, I've always prayed to the Lord to help me help others. And I learned to be careful what you pray for, because I found out there are a lot of folks out there who need help. So seriously, though, back probably in 1987, I was in my 3rd year of marketing, working on my marketing degree, and I also worked for an ad agency. And I just knew that I couldn't see myself continuing down that career path, even though I loved the creative aspects of it. It just didn't light me up. And so my fiance at the time, he's now my husband of 29 years, Ken, had come from a family of pharmacists. And he said, well, how about pharmacy? And I thought, super hard curriculum, lots of chemistry, and I get to count pills. And so he encouraged me to do some research, which I did. And I talked to his dad, who's a pharmacist and owned a pharmacy in my hometown that I'd been going to since I was in the 5th grade. I talked to his 2 uncles that were no longer independent pharmacists. They actually had gone to work for chains and decided to do something else, which was pretty telling. And then I found this article by Hepler and Strand on pharmaceutical care, and it was relatively new, this concept, but I took it to be the standard of care at the time. And so I thought, wow, it could really be cool. Doctors diagnose and pharmacists, well, we're going to prescribe. That's great. So 5 years later, I was the proud owner of an 8-year Bachelor in Pharmacy degree. And I would say, being the teacher that I am, that there were definitely some lessons learned from that 8-year investment in getting a 5-year degree. And I would say that first lesson is, practice self-awareness. Spend time really asking yourself, what lights my fire? what do I really want my life to look like? And what are the things that are most important to me? Not maybe your mom or your dad or your teachers, but what's important to me? And when I look back at my high school yearbook, I wrote that I wanted to practice preventive medicine. Now, my 17-year-old self knew what I wanted way back then, and maybe I would have saved those 3 years if I had practiced self-awareness a little bit better. But there's a second lesson in there, and I think that second lesson is that it's rarely a waste of time to pursue your interests, even if you end up quitting. So you can use those skills in ways that you can't ever imagine. Those years in marketing and advertising have really served me well as a small business owner, and I don't count them as wasted time. They're an important part of my story. During my first few years as a practicing pharmacist, I would often say, pharmacy isn't what I do, it's who I am. But now I don't say that anymore. Being a pharmacist doesn't really define me. It is what I do. It's one of the many things that I do. I'm a business owner. I'm a soccer mom. I'm a columnist. I was chairman of the board, and I'm a dance mom. I've taken drum lessons, and I want to design websites one day. So I have a lot of interest in creative pursuits. And I think the sum of all those things, that's probably a better reflection of who I am and where I am today.
Love that. Two nuggets there that I completely agree with you on. Number one, knowing yourself. I think that's super important as a career coach. I have tons of tests that I have individuals sit down and take on themselves. Mm-hmm. And then as well, you know, you're not just a pharmacist. We're all multi-patient anymore. We have a lot of interests. We're new Renaissance people. So I love that. So thank you for sharing that.
Of course. And thank you for all of your tools and tips. And so if people aren't aware of those, they should go download them, Erin, because they're super awesome. And you shared that back with us at Women in Pharmacy at Cardinal.
Yeah.
So people should, maybe you can put that in show notes to be able to download those. Those are super helpful.
So let's get back to, you had relatives that were in pharmacy. So why did you ultimately land on independent pharmacy as your career path?
Yeah, that's, so my first 3 years out of pharmacy school, I worked part-time in my father-in-law's pharmacy, Mullins Pharmacy, and it had been established like back in 1972. And then I also worked full-time as the director of pharmacy for a small psychiatric hospital, and eventually picked up a second location in another city. So did that for quite some time. And I went through 2 Joint Commission accreditations at the hospital. I rounded with doctors. I served on the Pharmacy and Therapeutics Committee. I trained nurses. I took call 24/7 by a beeper that I called my tumor. And I was the definition of clinical pharmacist, and I'm kind of putting that in air quotes. It's not really one of my favorite terms, but after all of that, it was clear to me that if I wanted the most flexibility to design my ideal clinical pharmacy practice, and if I wanted to fully benefit from all of my innovative ideas and passions, and to pursue all of my curiosities, then independent practice was really a no-brainer.
So any lessons there?
Yeah. I think having one true calling is rare. Hitting the mark and finding your ideal career might be a journey for some. For me, it certainly was. Years ago, I was awarded the Innovative Pharmacy Practice Award, but I didn't set out to create an innovative pharmacy practice. You know, that's not something you say, okay, I'm going to go out and do this and win this award. And, you know, you just kind of do your thing. And one thing that I've learned is that innovation comes at the points of intersection between your skills and your experience. And so I'm a teacher, I'm a diabetes geek, and I'm an entrepreneur. And those skills and experiences birthed a pretty successful diabetes education center. We were the first to get paid by Medicare in the state of Florida, and we were a model that's been studied by Columbia University. And I've personally educated over 1,000 students in my diabetes center, and I know without a doubt that I've made a difference, which is the essence of why I chose pharmacy as a career. And it's our vision statement at Mullins to make a difference in the life of every patient we serve.
Love that. And so for our conversation today, what really sparked it was the launch of the new NCPA Digest, and that was sponsored by Cardinal Health, so shout out to them again. And it's available to NCPA members, and of which you are an immediate past president. So can you share some of the exciting trends with us from this recently released report?
Yes. And first I'll tell you a little bit about NCPA, if I may.
Sure.
NCPA was founded in 1898, and it stands for the National Community Pharmacists Association, for those of you out there that don't know or aren't familiar with NCPA. And we represent the interest of America's community pharmacists, including the owners of more than 22,000 independent pharmacies. And many people think of independents as small mom and pops, but if you combine all of the Walgreens, the CVS's, and the Rite Aid stores, put them all together, you get about 22,000 pharmacies. So independents are still a significant force in the market, and we fill a little over 1/3 of the nation's retail prescriptions. And I kind of like to think of independents as laboratories of innovation. And oftentimes those innovations elevate our entire profession, which creates opportunities for all pharmacists. And I'm really proud to be a part of that. I did just finish up my term as president, the third woman president in 118 years, Erin, but who's counting?
Yeah, I need to divert a little bit there for a second, and because I'm going to get on my soapbox for a second too. We don't have enough women leaders at the helms of organizations in pharmacy. Why is that? And what do you think we could do to help? And I know that wasn't a question that I originally gave you, but
yeah, no. Why aren't there more leaders? I think it's multifaceted. I think there are, we talk a lot about unintentional kind of subconscious or internal bias, and that starts really young. And so I think that plays a role. I think that the sheer nature of women as the primary caregiver in the home produces some challenges. So, if I'm going to break the glass ceiling and I'm going to be head of a major company or corporation, at some point I'm going to have to grapple and get over, my desire or need to be a mom. And I look at, let's take Doug Hoy, our CEO at NCPA. Okay. Doug travels nonstop. And, I look at his, and I've worked with him very, very closely for my year as president, but I've been on the board, 8 years, and I've been in leadership for more years than that. And I've known Doug, honestly, since we both graduated. So I've kind of watched his progression, and I don't know that I would say, I'd want his job, because it requires so much time away from home. And a lot of those types of jobs require relocating to other cities. And I think that the family dynamic presents a barrier. And it's not the only barrier, but it certainly is one. And I think not having enough role models out there. And so I think it's really important that we give our young girls role models, and we're conscious of the messages and the signals that we send, in our conversations and in our expectations.
Agreed. And sorry for me going off on a tangent there.
No,
Stepping
sorry.
off the soapbox now. All right, let's get back to the NCPA Digest.
So the Digest, it is sponsored by Cardinal Health. So as you said, shout out to those guys. It's been around, the Digest itself has been around for over 80 years. And it's basically a summary of financial and demographic information. It's data, facts, figures, pharmacy profiles about the independent pharmacy market, which is about an $80 billion marketplace, by the way. It also highlights the services that we deliver to our patients. It's a management and benchmarking tool for pharmacy owners, and it can also be a tool for our elected officials, because it paints a picture of the impact independent community pharmacies are making on their local communities. The 2017 Digest this year was released in October at our annual meeting, is based on 2016 data, and it's broken down into 4 sections. Basically, we look at the marketplace, we look at patient care services, technology trends, and lastly, third-party prescriptions.
Okay, so 4 parts. Tell us about some of the trends that came out of it.
Yeah, there's a lot of data for all of the data geeks out there, and data can be great and it can be really boring. And so when I was thinking about our conversation and all of these facts and figures and numbers, I thought, what's really exciting to me is a trend that I see, and I would kind of call it adaptability. What the digest tells me is that independent pharmacy is alive and kicking, and that we are adapting to the changes needed to survive and thrive. Independents are adapting. Fast Company magazine defines adaptability to be the single most important skill to develop in order to thrive in the 21st century. So you need to be able to pivot, and you need to be able to adapt to the markets. And right now, pharmacy is definitely pivoting. Think about MTM, immunizations, MedSync, specialty pharmacy, value-based care, high-performing networks, pharmacogenomics. It's a long list. And we have a lot of complex, multidimensional problems in healthcare right now. So we need creative, out-of-the-box thinkers to tackle them, right?
Yep, definitely.
So the digest shows that independent community pharmacists have proven throughout the years that they are resilient and will modify and reinvent their practices to adapt to economic challenges. We have the power to determine the future of pharmacy through innovation and exceptional patient care. The digest shows that we are vital healthcare providers to our patients and that we're dynamic leaders in our communities.
Okay, that's a great overview, and the strategy person in me loved that. But for the data geeks out there, can you break it down a little bit for us?
Yeah, so some of the highlights, some of the things that the digest shows, which is basically the independent community pharmacists that responded. So the respondents, and there were a few hundred of those.
Okay.
Responded to the survey questions, and said this is a kind of a compilation of that. But there's an estimated number of independent community pharmacies that right now is down a little. So last year we had 22,160, and this year 22,041. And quite honestly, I don't know that that's a trend. I don't know that that's a signal really of a whole lot. And for me, it kind of tells me we're down a little, but we're pretty much holding strong for now, which is great. We represent 36% of the retail pharmacy marketplace. An interesting fact, 81% of community pharmacies serve population areas of 50,000 or less. So that's a big number, kind of showing how important independents are to our rural communities and our small towns, and how imperative it is that we protect those services, to our most vulnerable.
Sure.
Some other fun facts. 52% of total prescriptions are covered by Medicare Part D and Medicaid programs. So the government is our biggest partner for sure. Mm-hmm. 90% of community pharmacies are offering some type of medication adherence program, which I thought was really encouraging to see, because medication adherence, I think, is an area where we can really impact quality of care and, improve outcomes overall. And probably one more, below-cost reimbursements exacerbated by DIR fees in Medicare Part D contribute to gross margins falling by 5% over the past 5 years. So we really are seeing kind of this race to the bottom. Reimbursements are getting squeezed in pharmacy just like they are across all sectors of healthcare. And those DIR fees are really taking a toll.
What about technology or community pharmacies, for example, embracing social media?
Yes, actually, the digest tells us that 86% of independent pharmacies utilize Facebook, 64% use a mobile app, and 23% have a Twitter account. And in terms of workflow technology, 88% of pharmacies use point of sale technology. And we also are big utilizers of IVRs and automated dispensing systems. We use an icon in the pharmacy, which I dearly love. We've named him, and when he's not feeling well, it impacts us all tremendously. So independents are definitely evolving and utilizing and leveraging technology because it helps us be more efficient. And efficiency is the name of the game if you're going to stay in business. So,
yeah. So, DeAnn, what other trends at a broader level are you seeing in independent pharmacy practice and practice overall? I know you talked about, the adaptability factor, but what other trends are you seeing out there?
Yeah, so probably a couple trends I'd love to talk about. First, 4 drivers of mediocrity in healthcare that I'd like to go over with you and mention. And then some of the transformative trends that are going on that I think will have a dramatic effect on pharmacy as we know it in the future. But before I do that, if I could set the stage a little.
Sure.
So we are pharmacy. We're the 3rd largest healthcare profession, the most accessible, one of the most trusted, and we add value. But unfortunately, we are often underutilized and sometimes underappreciated. So I believe that pharmacists are not just commodities tied to selling stuff. We are first and foremost healthcare professionals. And I know you agree with that, Erin. I know where you stand on that. I would argue that pharmacy is not a cost center. It's an investment. But we've been siloed, and silos have stifled us. They've divided us, and I think it's time that we break down those walls. And recently on Twitter, a pharmacist was tweeting about his patient, and he was talking about his patient this, his patient that, and a doctor tweeted back and said, "You have customers. I have patients." Yeah, and I thought, well, you know what, Dr. Twitter Troll? Healthcare is changing. And, we are changing. We are moving from a fee-for-service, volume-driven system to an outcomes or value-driven system. And healthcare needs pharmacy to provide its maximum value, and that means being an integral part of the healthcare team.
Yeah, so let's unpack that. Tell our audience and our listeners more about that.
Yeah, so change is coming, and I think that's a really good thing because healthcare needs to change. We focus on sick care. Providers get paid to do things to people, to write prescriptions, to order tests. We overuse and we overtreat and we overmedicate, and we undervalue what keeps us healthy. We are the most obese, addicted, medicated cohort in U.S. history, and yet we have had 50 years of hyperinflation in healthcare. Consumer prices have increased 8-fold compared to healthcare prices, which have increased 274-fold. And that has caused catastrophic collateral damage to wages, to retirement, to education, infrastructure, and our caregivers themselves, our clinicians.
Yeah, and unfortunately, you're not the first guest to talk about this kind of, we're not about health and we're not about care. So what do you think is the root cause of all of this dysfunction?
Yeah, so what drives what I call that mediocrity? So the 4 drivers of mediocrity, and there are probably others, but what comes to mind mostly is what I said earlier, fee for service. Providers getting paid to do things to patients. I mean, that's the system. That's how we've set it up. And so what do you expect? If you get paid to do things, you're going to do things. When we get paid for outcomes, then, maybe we'll get better outcomes. That second driver of mediocrity, misaligned payment incentives. So do you see diabetes self-management training centers popping up, on every corner like you do dialysis centers? Unfortunately, no. We pay for complications instead of paying to prevent them. That third driver, silos and fragmentation. Those lead to very little coordination and accountability. And, with pharmacy being a cost center, this is a good example, and it happened in my own pharmacy. I recently had a PBM deny paying for a medication, McPhyton, vitamin K, for one of my Part D patients who had a dangerously high INR level. He's in his 80s, he lives alone, and when we tried to fill that prescription, the PBM said no. So called and we said, look, what are our options for this patient? Because this is super dangerous. What are we supposed to do for him? And the PBM basically said, send him to the emergency department. We're not paying for it.
Wow.
Yeah. So, if I could have talked to the plan sponsor who had all of the cost incurred for that patient's care, not just the pharmacy benefit, I know that plan sponsor would have chosen to pay the $180 that the vitamin K cost over the $15,000, emergency department bill. Going back to that whole pharmacy is not a cost center, we are an investment. So, and then fourth, redundant care and duplication certainly lends itself to poor quality and expensive care. So those would be some of the drivers of mediocrity. I think what's exciting are the kind of the trends because of that mediocrity, or not maybe because of, but in spite of, but the trends that are kind of heading our way to help us deal with some of that.
Thanks for listening to another episode of Farming Your Career. I'm Erin Albert. This podcast mini-series is brought to you by my new online course, 57 Cool Jobs for Pharmacists. You can find it over at farmllc.teachable.com. Maybe you're at a career crossroads and you need to dissect and figure out where you want to go next in terms of your career development. And I would love to help you with that. Again, go to farmllc.teachable.com.
Thank you for listening to another episode of the Farming Your Career podcast, part of the Pharmacy Podcast Network. If you have ideas or comments for Erin, be sure to contact her through Twitter. Follow her at Erin L. Albert. And remember to keep your career growing.